Hi, I'm Dr. Sahni. I'm the Clackamas County EMS Medical Director, and I'm also an emergency physician that practices locally in the community. I love living and working in Clackamas County because I love the natural beauty that we have to offer. I like to get on my snowboard when I can and go see Mount Hood. Okay, Norma H. writes, let's talk about the side effects of the vaccine. That's a great point, Norma. The side effects of the vaccine commonly are things like fever, feeling a little bit run down, feeling like you kind of got sick for a day or two. When I got my third shot, I made sure to plan the next day to have off. I actually planned it so that I could watch football all the next day. I didn't tell anybody in my family that I was not having any side effects because they left me alone to watch the football all day. And by the way, Michigan won. Michelle T. writes, the biggest risk factor in COVID is obesity. I am not sure if it's accurate. Truth is so elusive. But I read that 78% of hospitalized are obese and up to 90% of deaths had obesity. So I guess, Michelle, why would you write it if you're not sure it's accurate? I'm just curious there. The reality is that, yes, people who have more risk factors, such as obesity, such as other medical problems, or are older than 85 or 65, have a higher risk of dying. But I will tell you this, today with the Delta variant, the majority of people that I am seeing in the hospital who get admitted, who get sick, who get put in the ICU are unvaccinated, and they are much younger than they were a year ago. Willie F. writes, according to VAERS, 11,000 deaths have been reported. You do the math, and then tell us how safe this experimental vaccine is. The reality about the VAERS data set is that it is not a research data set. It is an open reporting data set that anyone, any person can go online and put data into. And so if somebody has an agenda to put false data in, they can do that. You can go in today and put data into VAERS. Now the reality is it serves a great purpose. When there are things reported in VAERS that cause somebody to have concern, the right people pull those charts, pull that data and review it. And I can tell you this, that there has been no data tying a significant number of deaths to the vaccine. Cindy S. writes, why isn't exercise, breathing fresh, clean air, a healthy, nutritious diet, a healthy, nutritious diet, rather, sunshine, proper hygiene, vitamin supplements, positive mental health practices ever promoted? You can find studies to support whatever agenda you're pushing. Muzzles are not the answer. Well, Cindy, I'll tell you what, some of that stuff is a great idea. I think exercise is wonderful. A healthy, nutritious diet is a great idea. Hygiene is good. Vitamin supplements, not so much. There's really no data that any vitamin supplements help you in the long run. But I can tell you this, a healthy lifestyle may help, but this is an infectious disease. That means this disease is carried from one person to another. And the way to prevent the passing of an infectious disease is to do things like wear a mask, or most importantly, get vaccinated. And finally, the best way to not die from COVID is to not get COVID. Star R writes, you are all complete misfits, allowing the illegal crap happening in the country. Propaganda, bullshit, COVID crap. Where is the data? The real data. You don't have any. Well, Star, I call bullshit on your bullshit. There's actually plenty of data out there that shows that COVID is a real disease, that the number of deaths from COVID is now well over 720,000 people in the in the United States. And in fact, the number of excess deaths in the United States is well over 1 million. That means over 1 million more people died than would have died without the COVID.